So welcome back. Today we will be learning about Frankel's ladder. Now most of you have probably seen this. It is known as an agility ladder used by athletes, where it's kind of like a rope ladder on the floor, and athletes use it to increase their speed and their agility. But in physical therapy, it's used to help to teach the patient how to walk again. And when I was in rehab and I had to do the same, my therapist used this to help me show where I needed to put my feet and how to step forward and backwards, etc. When I asked my therapist, what is this? He said, it's called Frankel's ladder. And so I asked him, why is it called that? And as any good teacher, he said, look it up. And so I did. And that's when I found out about the forgotten father of rehabilitation medicine, Heinrich Frankel. Frankel was born in 1860 in Switzerland in a small village called Heiden on the border of Germany. And he goes to Germany to medical school, becomes a neurologist, comes back to his village, and his interest is, why do some patients after a stroke seem to get better easier than other patients, or more than other patients? And he sets up his clinic, and in 1887, he gets a farmer who fails the finger to nose test. This is a neurological test, and what it measures is how good a patient's cerebellum is working. Now, the cerebellum is the back part of the brain, is very small, and it controls fine motor movement. So in this test, the patient has to touch their nose and then the examiner's finger over and over again as quick as they can and as accurate as they can. Because the cerebellum controls balance and speaking and walking, etc., it's a very important part of the brain. So in this case, the farmer failed the test. And when he asked Frankel what had happened, Frankel said, well, you've had a stroke, so go home and rest as much as you can and come back in 3 months. Because at that time, the standard of care was to have the patient rest as much as they could, get more blood to the brain, and recuperate. Well, the farmer goes home, and in 3 months he comes back, and he does the finger to nose test perfectly. And Frankel is amazed. He's like, how did this happen? And the farmer replied that he knew he was going to be retested in 3 months, so he practiced every day. And this then leads to Frankel renting a house in his village, setting up a rehab center, as you will, and he sets up walking bars. He makes chalk marks on the floors where patients have to put their feet to walk, and he lines the place with mirrors, pretty big mirrors. And at this time, mirrors are actually very expensive. They're not yet mass produced, so this was an expensive undertaking. And within 2 years, he's able to present his work at a conference in Germany where he says, look, this really works. After stroke, patients, the more they can exercise, the more they can do the things they did before, the more they will improve. And within 10 years, he then moves to Germany and he works there for about 30 more years. He's made the head of everything important neurologically, but as a result, this village becomes very famous and many doctors flock to that area to learn his technique. Since Dr. Frankel's achievement and since his discovery, the world has learned a lot about stroke recovery. There's been a lot of research, a lot of studies, a lot of articles, and basically it comes down to the idea of brain plasticity. This has many different names, but it basically means that the brain can make new neural pathways. So if one part of the brain is not working, then another part may take over and make a pathway so that the patient can gain some of that function back. But a few things have to be taken into account. Number one, the sooner the better. So within the first few months of the brain insult is probably the best time to build those pathways. Number two, repetition. So doing the activity over and over again cements that pathway a little bit better in the brain. Number three, maintenance. This is something that the patient, once they learn, it's not as if they learn it for a few months and then they forget it. It's something that they have to do over and over again, usually for the rest of their life, to maintain that function. Number four, it's a lot of hard work and it's very tiring. on a mental level. And when a stroke patient gets tired mentally, then their deficits become more obvious. So if they had trouble walking, when they're tired, they will have trouble walking. If they have trouble speaking and they could actually normalize it, when they get tired, they start to slur, they start to limp. So their deficits become more obvious. And in this day and age, also in the past couple of decades, we have really realized the importance of mental health and emotional health when it comes to all of this. Now, taking from a personal account from myself, there are things that I did differently as a doctor that definitely helped me come to the point where I am today. Number one, as far as the first 3 months after my stroke, I did not allow any visitors. I didn't visit people. I just focused on my rehab. Number two, when it comes to repetition, I actually printed out 500 tongue twisters from the internet and I went through them 3 times a day because I had trouble speaking. So to clear up my speech so I could actually return to patient care. And what I would do is the easier ones I would take out of that pile and I would only leave the hard ones in the pile and I would still go through them 3 times a day. Number three, as far as maintenance, one of the things I would do is I still do this to this day is I look for opportunities of rehab everywhere. Whatever my physical therapist said, walk this way, do things this way, I still do it to that day. And I remember a particular instant after my stroke, maybe 3 months or later after my stroke, I was in a gift shop and I really wanted to recreate what my occupational therapist had done, where they had taken this board and they had made little holes in it. And you basically had to take these wooden pegs and put them in the hole. And you have to do it with one hand and then with the other hand faster and faster and see if you could match up. Because for me, I've lost the ability to write. I've lost the fine motor on my right side. And I was in this gift shop and I saw this tea set and it had a little teapot and it had 6 little teacups and they all had magnets at the bottom and they stuck to the tray. And so I bought this and I took it home and I used it for therapy because what I would do is I would take things off the tray and with one hand I would practice putting it back and then I would take it off again with the other hand I would practice and I would do it faster and faster until I got better at it. As far as a lifelong maintenance, yes, I still do it to this day. And it is very hard. It is very tiring. And so I have adopted 2 rules that have really helped me function as I do today. Number one, almost every hour I reassess what are the 3 most important things I have to do soon, and out of them, which is the most difficult, because I will do what I find most difficult first, because brain energy then gets conserved and it gets used on the things that are the most difficult first. Secondly, I never waste a trip. So for example, where I have my bedroom, if I have to go to the kitchen for a glass of water, but there's the bathroom on the way, I will drop off clothes that I will need for work the next day at the bathroom, get my glass of water, on the way back, grab some mail off the table that I will look at later, and then back to my bedroom. So in this way, I've really conserved my energy. And then finally, my outlook. I really, really know, and I'm very grateful that the universe has definitely come together and saved me. But I do have bad days. I do have days where it's very difficult to just walk straight, just to talk without slurring, just to swallow my foods, etc. And on those days, I tend to focus on what I can do and I don't worry about the rest. And this has really changed my outlook on life because now I know what is important, what I need to hold on to, and what I should just let go. As Norman Vincent Peale said, change your thoughts and you change your world. Until next time.